This sounds strange, but when some men apply this simple oil to their abdomen before bed for 1 week, they notice changes in sleep, digestion, and even morning erections, not because it's magic, but because of how the body responds at night. Before we go any further, I want to be clear from the start. This is not a treatment. It's not a cure, and it does not replace medical care. What I'm describing is a simple nighttime routine that may support relaxation, sleep quality, and recovery. And those systems are deeply connected to male energy, hormones, and sexual function. I'm Dr. Michelle Zion. I focus on men's health education, particularly how sleep, stress, circulation, and daily habits affect the male body as it ages. Many men come to me convinced something is broken, when in reality, their body is exhausted, inflamed, and stuck in a constant stress response. Castor oil enters this conversation not as a miracle substance, but as a tool some men use to create a calming and consistent bedtime ritual. Castor oil is a plant-derived oil rich in a fatty acid called ricinoleic acid. In medical literature, it is best known for its use as a stimulant laxative when taken orally, which is not what we are discussing here. When used topically, castor oil has traditionally been used for skin hydration, warmth, massage, and relaxation-focused practices. There is no strong clinical evidence showing that topical castor oil detoxifies organs, increases testosterone, or directly treats erectile dysfunction. Anyone claiming that is oversimplifying complex biology. However, there is solid evidence showing that relaxation, improved sleep, reduced inflammation, and nervous system balance play a major role in male sexual health. That is where this routine fits. Many men apply castor oil to a cloth, often called a castor oil pack, and place it over the abdomen before bed. The experience itself is simple. The oil provides warmth, and the gentle pressure from the cloth creates a grounding sensation. The body interprets this combination as safety and rest. When the body feels safe, it shifts out of a stress-dominant state and into the parasympathetic nervous system, often called rest and digest mode. Heart rate slows, muscle tension decreases, breathing deepens, and cortisol levels begin to fall. This shift is critical for falling asleep and staying asleep. Sleep is not optional when it comes to male hormones and erectile function. Most testosterone production occurs during deep sleep. Poor or fragmented sleep lowers testosterone levels. Chronic stress interferes with blood vessel function and nitric oxide signaling, both of which are essential for erections. Poor sleep also worsens inflammation and insulin resistance, which further impacts sexual performance. So when men report falling asleep faster, waking less during the night, and feeling more refreshed in the morning, it makes sense that other systems begin to improve as well. These improvements are not sudden or magical. They are the result of better overnight recovery. During the first 1 or 2 nights, many men notice warmth and relaxation over the abdomen. Some feel calmer before bed. Others notice less digestive tension, reduced bloating, or a general feeling of comfort when lying down. By the 3rd or 4th night, sleep quality often begins to improve. Men report deeper sleep, fewer interruptions, and feeling more restored in the morning. This is often when morning erections become more consistent, which is a sign of improved nervous system recovery during sleep. By nights 5 and 6, daytime energy may feel steadier. Brain fog may decrease. Mood often stabilizes. Some men notice improved libido and more reliable erectile response, particularly if their sexual issues were related to stress, fatigue, or poor sleep rather than underlying disease. By night 7 and beyond, men who continue the routine often describe feeling more regulated overall. Digestion feels calmer. Sleep becomes more consistent. Confidence in sexual performance improves. Stress feels less overwhelming. Again, this is not because castor oil is altering hormones directly. It is because the body functions better when sleep and recovery improve. Erections depend on multiple systems working together. Healthy blood vessels, responsive nerves, balanced hormones, and a relaxed psychological state all matter. Chronic inflammation, stress, and sleep deprivation disrupt every one of these systems. When a nighttime routine helps calm the nervous system and deepen sleep, it creates an internal environment that supports sexual function naturally. If you choose to try this routine, it should be done safely and realistically. Use an organic, cold-pressed castor oil in a glass bottle. Apply a small amount to a cloth or castor oil pack and place it over the abdomen, avoiding broken or irritated skin. Wear a shirt over it to protect bedding, and apply it about 30 to 60 minutes before bed. If you have sensitive skin, start with a small amount and gradually increase as tolerated. More is not better. Consistency matters more than quantity. This routine works best when combined with proper sleep hygiene. Avoid heavy meals close to bedtime. Keep your bedroom dark and cool. Reduce screen exposure late at night. These factors amplify the benefits far more than the oil itself. It is also important to understand what this is not. This routine does not cure erectile dysfunction. It does not treat low testosterone. It does not reverse cardiovascular disease, diabetes, or nerve damage. It does not replace professional medical evaluation. If erectile problems are persistent, worsening, or sudden, they should be evaluated by a qualified healthcare provider. Erectile dysfunction is often an early indicator of cardiovascular issues. Men who tend to notice the most benefit from this routine are those with high stress levels, inconsistent sleep, mild or intermittent erectile difficulties, and difficulty relaxing at night. This is a supportive habit, not a medical intervention. Sometimes improvement does not come from adding another pill or chasing a miracle solution. Sometimes it comes from creating the conditions your body needs to recover properly. Better sleep, lower stress, improved circulation, and calmer nights create positive ripple effects throughout the body, including sexual health. If this gave you a clearer understanding of how sleep, relaxation, and male performance are connected, consider subscribing to the channel. And if you try this routine, let me know in the comments what you are hoping it helps with most: sleep, digestion, energy, or sexual performance. Thanks for watching, and take care of your health.